Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician, 20 years in the game, best-selling author of the book Help Us Help You in the Emergency Room, and creator of the Mobile MD Kit and the Mini Mobile MD Kit. The Mobile MD Kit is the only first aid kit you'll ever need. And the Mini Mobile MD Kit was made expressly for these times to make it more convenient for us to be safe during this pandemic and also help make others safe because there's about 2 of everything in the Mini Mobile MD Kit. So you've got multiple things in the Mobile MD Kit. I'm gonna have to do like an opening of the kit one day to go over everything because there are about 25 things in that kit. And the Mini Mobile MD Kit has a reusable mask, surgical disposable mask, sanitizer, gloves, and even forehead thermometer strips. And you can check all of these things out on my website at drkadishamd.com under the shop tab. But what I wanted to go over with you guys today, thank you, Dr. Ken. Thanks for giving me a mini testimonial on the mask. I really appreciate it. And let me just turn down this music here. So what I wanted to go over with you guys today is some things that I'm going to be doing over the next couple of days. And one of those things will be the commitment process or the involuntary commitment process for Suicide Prevention Month with Dr. Ken Richmond, who's a corporate leadership coach and board certified psychiatrist as well as Air Force veteran. We will be on Sunday on this page, the Dr. Kadisha MD Facebook page at 1 p.m. Central, 2 p.m. Eastern Time. And I will also be joining the dear Carol Penn, Dr. Carol, and Dr. Dietrich in Perspectives in Primary Care on Monday. And we're going to be talking about pediatric obesity, and that will be at 8 p.m. Central Time, 9 p.m. Eastern Time. But I'll be posting the squares or e-flyers for those for both of those events. So one it will be Sunday, one will be Monday. But anyway, I just wanted to give you guys like a little review and see what else you guys are interested in talking about tonight. You know, we are headed into cold and flu season. I've already gotten my flu shot and had no complications with it. I've been getting the flu shot, for over 20 years now, ever since medical school, and it's working just fine. But I wanted to go over just some symptoms between a cold and the flu really quick, and then maybe touch on some differences between COVID and the flu, COVID-19 and the flu. So, you know, colds come on gradually. You rarely have a fever. You might have slight aches and pains. Chills aren't really common, and sneezing is common. You might have like a mild to moderate cough, stuffy nose, runny nose, rarely a headache, sometimes a sore throat. But the flu, unlike a cold, has an abrupt onset. The fever from a flu lasts usually about 3 or 4 days, whereas fever with a cold is rare. Severe muscle aches accompany a flu usually, while you might have slight body aches with a cold. Chills are fairly common with the flu versus uncommon with a cold. And yeah, guys, definitely hit me up in the comments to chime in or tell me of other things that you want to talk about or any questions that you might have. In the meantime, we'll just go over this. So fatigue is usual with the flu. It's sometimes with a cold. A lot of times people still power through a work day with a cold, but usually the flu stops them in their tracks. Sneezing is like sometimes with the flu, common with a cold. Stuffy nose sometimes, sore throat sometimes with the flu. Headache is common with the flu. And chest discomfort and cough, an important symptom, is mild to moderate during when you have a cold, and is common and can be severe with the flu. And another reason why I wanted to talk about the flu today is because, everyone's talking about COVID, but the flu is still out there. And there are still complications that we have to be mindful of when one has the flu. And I do know a number of people who will swear up and down that they had COVID last December, last January. They were never tested, and it could have been the flu. It could have been the flu. So, what are emergency signs of the flu? Because the flu kills thousands of people every year, and I just don't want people to forget that, focusing on COVID-19. Emergency signs that require medical care right away. We'll start with the children. Fast breathing, trouble breathing. If they have a change in color of the lips or face, if they become blue in the lips or face, or very pale. If you see their ribs pulling in with each breath, we call those retractions. If the child has chest pain, severe muscle pain, if the child refuses to walk, these are emergency symptoms of the flu. Dehydration. What is dehydration? Often we throw that term around during this season, and that is like not urinating for 6 to 8 hours, dry mouth, no tears when crying. Children, another emergency sign of the flu is a child being awake but not really alert. Seizures, fever above 104 Fahrenheit. In children less than 12 weeks, any fever at all in a child less than 12 weeks, that's an emergency symptom. Or fever or cough that improves but then returns or worsen, and any worsening of any chronic medical conditions that child may have. In adults, emergency symptoms of the flu include, somewhat similar to children, difficulty breathing, shortness of breath, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, or inability to be awakened. Seizures in adults, of course, not urinating in adults, severe muscle pain, severe weakness or unsteadiness, lack of balance, or fever or cough that improves but then returns or worsens. And again, as I said with the children, any worsening of chronic medical conditions. And this list isn't all inclusive. And definitely speak with your medical provider for any symptom that is severe or concerning, or come see this ER doctor or other ER doctors out there with any medical concerns that you may have. Thank you to all who just joined me, and you can check out this information on the CDC website. So let's see. I wish I could see more comments here, but definitely comment in there. I know it's late. Thank you so much for joining me, but I just wanted to go over those things there and just remind you that the flu is real. A lot of us have already been vaccinated. I've gotten my vaccine, as I do every year, and have had no issues with it, because the flu kills thousands of us every year, and there are serious complications that you can have from the flu, such as inflammation of the brain, which is encephalitis. You can have sinusitis, which usually isn't a big deal, but it can become severe. Pneumonia is a serious flu complication that can result either from the flu itself or from a super infection or a superimposed infection from a bacteria. So inflammation of the heart can result as a complication of the flu, which is called myocarditis. Again, inflammation of the brain, which is encephalitis, or muscle inflammation, which is myositis, or rhabdomyolysis, which can affect kidney function. When there's muscle breakdown and those muscle enzymes spill out into the bloodstream, which is filtered by the kidney, sometimes the overload from that muscle breakdown can infect our kidney function, and even, worst case scenario, throw us into renal failure. And this is all from the flu. We're not talking about COVID right now. The flu can cause multi-organ failure. For example, respiratory failure, requiring that I put you on life support. This ER doctor puts the tube down your throat and puts you on life support. And you could have kidney failure at the same time. If you have any kind of decompensation in your cardiac function, you might have a subsequent decrease in your kidney function because you're not getting enough blood flow to the kidneys. So, thus multi-organ failure can ensue from untreated flu, which is preventable with a vaccine. The flu virus infection of the respiratory tract can also trigger an extreme inflammatory response from the body, which can lead to sepsis, which is the body's life-threatening response to infection. This is all the flu, which can be prevented with a vaccine. The flu can, like I said, make chronic conditions worse. For example, people with asthma may experience asthma attacks while they have the flu, whereas normally they don't have asthma attacks for months or maybe even years. And people with chronic heart disease might experience a worsening of this condition triggered by the flu. There have been people who've had heart attacks due to the stress of fighting the flu infection. I'm talking about the flu. This is Dr. Kadisha talking about just the flu, a preventable disease with a well-known vaccine. A lot of people, even physicians, are saying how hesitant they will be to get the COVID-19 vaccine. That's fine, but how about getting the flu vaccine, which is well known and can prevent encephalitis, myocarditis, multi-organ failure. It can prevent sepsis. It can prevent having a co-infection between a virus and a bacteria at the same time that could cause so much stress in someone with heart disease. It could cause them to have a heart attack and they die from the stress of having the flu. Thank you so much, Dr. Ken. There are so many symptoms of the flu, and there's so many complications that I wanted to inform you or remind you of as I urge you to consider getting the flu vaccine. The CDC says the flu doesn't necessarily get anyone sick. A lot of people will insist that they've become very ill after getting the vaccine. Hey, Lisa, it was great seeing you at the gym today. Thank you so much. And you guys, please hit share, because, the flu is very contagious and we want everyone around us to be healthy and safe so that we, for their own sake, but we also don't want them giving us the flu either. Nothing like, catching something from someone else that was completely preventable by getting a shot that, in the process lasts just a few seconds. So just want to go over that. So we've gone over, for those who just joined, we went over the flu symptoms versus cold symptoms. Colds have usually like a gradual onset, milder muscle aches, less of a fever. You're not as fatigued. People usually work through colds. They often work out through colds and things like that. You might have more runny nose and sneezing. With the flu, you have, this abrupt onset. You feel like you've been hit by a truck. You might have severe body aches, higher fever, things like that, and it leads to more complications. So just wanted to go over that. Now I'll say, okay, so now we'll talk about the flu versus COVID-19. And, we all know COVID-19 has a wide range as far as its presentation. Okay, it can be from mild symptoms to severe illness. I was just told of a story of a parent and child where the parent, even though they had significant comorbid chronic conditions, chronic diseases and things like that, they had COVID, but they did okay with it. They didn't have severe symptoms with it, but their child, who was a young adult, actually passed away from COVID, and they had no known chronic medical conditions. So again, that's why they use the word novel, because you don't know. We still are learning as we go how this virus will work and how various individuals will respond to it. It's completely, we can't really predict it. We're seeing people who are young with no medical conditions passing away from it, and we're seeing older people with chronic medical conditions who might be asymptomatic or only have mild symptoms. But yes, do know as a general rule, people who are older and who have chronic medical conditions are more at risk of a severe course of illness than those who are like young adults, teens, even children. They might have less severe symptoms and an easier course of the illness. And Yvette says, I've had the flu before and it's no joke. Thank you. And I've had the flu before too. I've had it when I was in high school. And imagine a 14-year-old just wanting to lie in bed all day in the dark with no radio, no form of entertainment. I still remember lying in bed for at least a day, just lying there in the dark. Like all I wanted to do was sleep. No TV, no radio, no books, nothing to eat. I didn't want anything but to just lie there all day with the flu. And again, please share this. Do share this, because people think that, the flu is a mild thing. It's nothing to be taken seriously. And they actually compare COVID-19 to the flu. The flu kills people every year. It kills thousands of people every year. But okay, so now that we've gone over the flu type symptoms, we'll talk about COVID-19 symptoms. Again, wide range of symptoms reported. Symptoms can appear from 2 to 14 days after exposure. Usually with the flu, you will get symptoms, like maybe anywhere from like 2 to 5 days after exposure to the virus. So symptoms of COVID-19, just as a review, we talk about it so much, I'm sure a lot of you know this, but fever and chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. And unique to COVID is the new loss of taste or smell. So that's one, those are distinguishing characteristics of COVID. And, this is not the complete list of symptoms. Even the CDC says this isn't all the symptoms, and they will continue to update this list as we gain more information. But emergency warning signs, just like I talked about emergency warning signs of the flu, there are emergency signs for COVID. Since a lot of us, are telling you guys, doctors telling you all as patients to manage this at home so as not to clog up the hospital systems, we do want you to be aware of symptoms for which you need immediate medical care. And that does include, for COVID, emergency symptoms for COVID, trouble breathing, persistent pain or pressure in the chest, new confusion. And you could see that possibly with the flu. That confusion could be a sign of encephalitis, which is inflammation of the brain, which is a known complication of the flu. But you can have new confusion with COVID as well. Inability to wake or stay awake. Bluish lips or face, also with COVID-19. And what we want you to do is call 911. I know I work with the city of Houston with the fire department. I talk to paramedics all day, and but I also speak with patients when I'm working in the ER, and they tell me how paramedics discourage ambulance transport for various symptoms. If you feel that you cannot, if you have any concern about the severity of your symptoms, you insist that you be transported by ambulance, okay? Because in the course of my job with the city, I have paramedics calling me to see if a patient is stable enough to go by cab or self-transport to the ER. And sometimes the condition is more severe than they realize. So, so if you feel like your symptoms or your condition is more severe, just tell them, no, I want to go by ambulance. Take me by ambulance, because you know what? If you do transport yourself on to the ER on your own, you have to walk in, you have to go through registration, you have to sit in a waiting room, and while they hope that you are stable enough to wait, and you may or may not be, you may actually be right and have a more severe condition than you realize. Or like we have in Houston, we have freestanding emergency rooms, which are true emergency departments. They're not urgent cares, they're not ready clinics, they are emergency departments with board certified emergency physicians like myself, with CAT scans, labs, and all of that, but they are separate from hospitals. And I'm seeing that paramedics are convincing people not to go by ambulance to the hospital, but to get in a car and come to a freestanding ER where I may typically work. And if you are severely ill enough, we're going to end up trying to transfer you to the hospital anyway. So so that it may delay it might delay your process. But then sometimes freestanding ERs can get you admitted to a hospital bed quicker than the hospital ER staff, because they typically have more patients than freestanding ERs. This is hospital-based ERs. They may typically have more patients than freestanding ERs, and the freestanding ER may do your workup a lot quicker. So we'll have your CAT scan, X-ray, or lab results quicker because there are fewer patients to address. And we will call the hospitals and get on the phone with an admitting physician, sometimes quicker than hospital-based ERs. So, so you do have choices, especially here in Texas and other states that have freestanding ERs like Colorado and Rhode Island. And there might be other states. I'm sure that, more and more states will have freestandings as we go. But I didn't want to be on here too long. I know it's late. Thank you so much for joining me. Do share this discussion. We talked about the symptoms of cold versus flu. We talked about symptoms of flu versus COVID. And we talked about emergency symptoms of flu and COVID. We talked about complications of the flu, because the flu is real. The flu has been here. It's killed people, thousands of people every year, even before COVID. And, there's concern about the twin-demic, the flu and COVID combined, causing a twin-demic over this season. And Dr. Ken had recently shared with me that there was a prediction that while we're at 200,000 deaths at this point, the prediction is that by the end of the year or beginning of 2021, we might have 371,000 deaths. And it could be from COVID, but you got to add the thousands of deaths that the flu causes, and then the possible mortality from having the combination of flu and COVID. So why not prevent having to fight a twin-demic infection? Why not prevent having to fight COVID and the flu by getting a flu shot? At least prevent that one thing. You know, you fear vaccines. People fear vaccines. They distrust vaccines. I've been getting vaccines for over 20 years now, and the flu is preventable. And, you know, it's saddening to know that thousands of people die every year from a preventable illness. This is not the 1800s. This is 2020. That shouldn't be happening anymore. And now, this year, it's even more important that we get the flu vaccine, since any of us could be vulnerable, could be infected by COVID-19, and you don't know what kind of course yours will be should you become infected. Even if you you feel completely healthy, you never know. People who are completely healthy and in great shape do pass away from this illness, whereas people who you would expect to be more vulnerable aren't. So that's all I wanted to share with you guys. Please don't be afraid of the flu vaccine. Prevent one of the twins of the twindemic this year. Hopefully we can decrease the number of flu-related deaths this year as we go into this season, wondering what the heck COVID-19 is going to bring. Again, you know, do hit share, start watch parties with this. Hit share for anybody who has said anything that sounds uninformed regarding the flu vaccine, the flu, and COVID-19. And again, I am Dr. Kadisha. I'm your board-certified emergency medicine physician. Been a doctor for 20 years now. I already got my flu vaccine. All my coworkers have gotten the flu vaccine, as we have for the last few years that we've been working together with no issues. If you become really ill after getting the flu vaccine, most likely you had a mild viral infection already, and getting vaccinated may have caused that illness to become worse. That's the reason why vaccinations are withheld from people who are actively ill. If we know that you're ill, we're not going to vaccinate you. But sometimes you could be ill and not show symptoms until challenged with the flu vaccine, and then it brings out a more severe symptoms of an illness that you may have had. And viruses are tricky, and viruses are out there. There's, you know, multiple viruses: adenoviruses, rhinoviruses, noroviruses. There's other coronaviruses that aren't COVID-19. So again, I'm Dr. Kadisha, board-certified emergency medicine physician. Please check out my free presentation on ways to stay safe and well during this pandemic, and just really during cold and flu season as well. This applies to all viruses. Check out that special presentation at www.drkadisha.com. That's drkadisha.com. And thank you so much for joining me. And take care. Please be healthy, be safe. And I will talk with you next time. Hopefully I'll see you on Sunday as we talk about the involuntary commitment process with Dr. Ken, board-certified psychiatrist, and on Monday as we discuss pediatric obesity on perspectives in primary care from the emergency, inpatient, and outpatient perspective. Thank you so much. Please share, and I'll see you next time.